All right. Thank you, Marty. It's a hard act to follow. But thankfully, I have a book to help with the transition. And so, as you saw at the title of this talk, we're using Stone Soup by John Muth. And so I'm going to read a little bit at the beginning here and then a little bit at the end to kind of help frame our conversation here today. And then we'll kind of start kicking it to our panelists. So, 3 monks, Hawk, Lock, and Sue, traveled along a mountain road. They talked about cat whiskers, the color of the sun, and giving. "What makes one happy, Sue?" asked Hawk, the youngest monk. Old Sue, who was the wisest, said, "Let's find out." The sound of a bell brought their gaze to the rooftops of a village below. They could not see from so high above that the village had been through many hard times. Famine, floods, and war had made the villagers weary and untrusting of strangers. They'd even become suspicious of their neighbors. The villagers worked hard, but only for themselves. There was a farmer, a tea merchant, a scholar, a seamstress, a doctor, a carpenter, and many others. But they had little to do with one another. When the monks reached the foot of the mountain, the villagers disappeared into their houses. No one came to the gates to greet them. And when the people saw them enter the village, they closed their windows tight. The monks knocked on the door of the first house, and there was no answer. Then the house went dark. They knocked on the second door, and the same thing happened. It happened again and again from one house to the next. "These people do not know happiness," they all agreed. "But today," said Sue, his face bright as the moon, "we will show them how to make stone soup." So, to me that speaks a lot to maybe how some of our systems work and see their role. And so we are happy to be here and talk a little bit about early relational health's view in our systems and how there's evidence of success and opportunities to continue to do more. And so I'm really fortunate to have a wonderful panel up here with me. I'm going to let them introduce themselves. And I always like to kick off by asking, why did you say yes to the panel in the first place? So I'll start with Pahoua to my left, and we'll kind of go down.
Thanks, Nate. Is my mic on? Okay, great. Well, I always have like a canned, open, introduction for myself. But I'm going to go off script. I was so moved by the talk, Dr. Lee, and some of the comments that were made earlier. So I'm going to try something out. You look a little worried.
Let's do it. Let's do it.
I think I'll introduce myself this way. So I'm Pahoua Hoffman, and I think the piece that I want to say is I'm the oldest of 4. I'm the only one born overseas. My parents and I came as refugees and immigrants. I was a baby when I arrived, and so I don't have a recollection of that immigrant experience until I started going to school and seeing how other people treated us, and my parents in particular, and the challenges I had as a student, learning English, and being raised by parents with limited English. And so someone made a comment about cultures. And I think that we don't give a lot of credit to, in my household, we had a multi-generational household. And so I grew up with grandparents in the house. And so I said yes to this topic and to be part of your conference because I'm really proud of the work that we're doing to help support community members in early relational health, but it also is how I was raised, and I think that the way that we are raised often brings us to the work that we do. I imagine this room is full of people who can nod in agreement. It also brings me to the work that I do, so I'm newer to HealthPartners. I lead our government community relations, but I don't have a healthcare background, and by design, HealthPartners brought me in without that background, but we're interested in the community relationships that I had to bring to our work and to also challenge them and our health system in doing things differently. And so that's another reason why I said yes to them, which I think connects to our talk today. So thank you for having me.
Thank you, Pahoua. And that was right on script, so we're good. Aditi.
Thank you, Nate, and thank you to the organizers. Thank you, Dr. Lee. That really was incredible. Aditi Mallick, I'll give you a bit of who I am, and then I promise to answer the question. Aditi Mallick, I'm the acting director for the CMS Office of Minority Health. Also wear the hat or hold the role as Chief Medical Officer of Medicaid and CHIP for the Centers for Medicare and Medicaid Services, also known as CMS. We in government love acronyms, but essentially the federal agency within the U.S. Department of Health and Human Services that oversees Medicare, Medicaid, and the marketplaces that were set up by the Affordable Care Act. 3 answers to your question, Nate, of why am I here? So one is maybe what I just told you. My day job is in the world of policymaking and inside the Beltway, for those that are familiar with DC and the greater DMV. And in recognition of the fact that Medicaid insures more children than any other insurer in this country. 40% of births are covered by Medicaid, a higher percentage of those births to parents that are Black, Hispanic, American Indian, Alaska Native, and from other minority communities, and that there has to be a linkage, to your point about early relational health became a thing in the world of medicine long after it was a thing for, I realize, many people in the room. But really, I think the intentional connection between interventions that promote health for the future of this country, children, and being able to fund them through healthcare, right? Not that it is the sole role of healthcare to fund those things, but I think it is an important place to start. Point number 2, I'm a doctor, trained as a physician. My patients are big people, not small people, unlike Nate. So I'm trained as an internist, spent many years as a hospitalist. But that idea of whole person health that I think pediatrics has long championed has increasingly become an area of focus in the world of medicine and health for people of all ages. We in medicine, I think, have a very bad habit of micro-knifing people into different organ systems. So you go to this person for your GI system and this person for your heart and this person for your brain and your nervous system. But not only are we all have one ecological body, we exist in an environment where our relationships and the social factors have, in fact, an oversized impact on our health outcomes than does anything somebody in a white coat or within the 4 walls of a clinic or hospital would do. And I'll just say, last thing on this before I move on to the third piece, the burgeoning literature around social connectedness and loneliness, and it's as bad for you as smoking, right? Being lonely and isolated as an adult or as a small person, but as an adult is incredibly detrimental to your health. So to me, again, wearing my physician hat, it's really important that we have that conversation in the context of how are we keeping people healthy holistically. And then last but not least, I'm a mom. I have 2 daughters. I have 2 daughters as well. I have a 4-year-old and an almost 2-year-old. My little one will be 2 in August. And I will tell you, as a busy working mom in a dual professional household, that idea of carving out moments of joy and moments of intentional connection, put your phone away, the email can wait. If you need to get a hold of me, you cannot find me between 5:30 and 8 o'clock. I am with my kids, and that's it. That is non-negotiable. My husband does drop off, but bedtime is the sacred routine in our house. And I will say that in the context of I need to leave to go to the airport so that I can be at bedtime with my girls tonight. But reading is so core to how we find moments of joy and connection in our family. So all of that to say, thrilled to be here. Thank you for the invitation. That's why I said yes.
Thank you, Aditi. So, Jean-Calvin?
Yes. Yes.
Yes. So, welcome. Can you just share maybe a little bit about yourself and then, why you said yes to the panel?
Thank you, Nate, and good afternoon, everyone. My name is Jean-Calvin Boock. I do have health insurance background. in risk management. I provided health insurance, group health insurance to companies where I had very, very close relationship with doctors, hospitals, and pharmacies, just to streamline the cost and control the service. But that's not why I'm here. Totally different. So some of you may ask, how do I fit in here? Well, I'm here because I'm a parent of 4 children. 2 of them were born at Bellevue Hospital, and they benefited from all the services that your program provided at Bellevue Hospital. So I'm very aware that it is difficult to measure success. How do we know that the service we are providing is being successful? The project we are managing is meeting really the goal that we hope for. So I'm here because I want to be one of that person who firsthand can testify that, yes, my children benefited from the early relational health services. And I'm going to elaborate a little bit more when I'm given the opportunity. Thank you.
Thank you. And we should note that your daughter Martha was actually supposed to join us, but her, as I understand, AP exam got rescheduled, and so that took priority, over.
Yes.
So and so you'll be repping her as well. And so we can start there and kind of come on the way back. So Jean-Calvin, you mentioned your role as a dad, as a parent, right? I think one that we all share on this panel as well, in addition to our other titles. But from your experience, can you maybe talk a little bit about, how it was mentioned in the comments too, early relational health is really capturing something that has existed before in not only the kind of described literature, but really in communities, in cultures, for generations. Can you speak, though, maybe to how, from your experience, that was supported in the clinic as you were bringing your kids to Bellevue, and what features of your interactions in the clinic setting you really seem to help support early relational health?
Yeah. I will say that from the early ages, because there are 3 of them who really benefited from the services. The one that is the youngest one, who is Lamarta. She's 17, heading to college this year. But before Lamarta, I had 2 who also benefited from those services. So what really was so important, it was to see those children of mine leave our very, very tiny apartment, go to the clinic for the services, and between sitting down with the doctor and the parent that we are, they always spend time with the program. They were took aside, in a room to spend some time to read, to play, and to interact with other children they did not know. And we as parents, me, my wife, who was very limited in English, so I am. We are French, so it was very, very difficult for her to go with the children all the time. So I was there with them all the time, just helping them to play first, because for them it was like a playground. But that playground was full of books, was full of other children who came to the clinic for services. And I can tell you that 2 of them, before Lamarta that you guys know, I have Yanova, who's today 28, and I was able to identify from those books how she was interested into drawing images that she was seeing from those books. Lamarta is totally different personality, based in history, in storytelling. She wants to know exactly what is the book is telling about. Today, Yanova, who also was at Bellevue Hospital, she is working as an airspace engineer with Collins Airspace Company in Westport, Massachusetts. And she sent me something that I'm going to read to you. So that's how impactful those programs can have on the children. Because we at home, in our apartment, we do not have the we do not have the tools to give them what they needed. It was so difficult for us, for my wife and myself. Very, very limited. Really, really limited. But those programs at least gave them the opportunity to feel as if they were playing at home, away from home. And I can tell you firsthand that it gave me the opportunity not only to instigate that learning appetite, but also being with them there, reading with them, I learned. I did learn. So it's not only about developing our child brains. We saw also, me personally, I learned my vocabulary. I owe some of my vocabulary from that kind of program. So it was very, very interesting, very, very beneficial to not only my children, who can today testify that yes, this is something that I benefited from. Just a few weeks ago, I'm taking Amata, who is 17, at Bellevue. I'm sitting, waiting for the doctor to call her, and Lamata jumped right away, seeing the children reading on the side, and Claudia was passing by. I did not notice that she was passing by. Lamata jumped. Oh, Dad, I remember this. Look, that I do remember this. Oh, my goodness, oh, God, do that. That's how Lamata was able to stop Claudia. I told her, okay, go talk to her. She said, no, don't. I said, go talk to her. Do you remember this? Yeah, go. So she was so captured seeing those young children 17 years later, doing what she was doing, and she was able to remember that. I had nothing to do with it. Nothing. But it was so interesting and so really, really important for me to be here today. Again, just to testify that, yes, this is working. And you guys cannot imagine how many children like my daughters are out there. So I'm here as maybe 1 cent in the beach. And I'm fully confident that if there's a way, if there's a tracking way, a database that can help this program to stay in touch with all the children benefiting from the program, you're going to realize that, hey, this is working. It is working. But how are you going to measure that? That's the key. When I came in today, I asked Claudia, how many parents are here? She said, you're the only one. I said, why? Only me? From a hospital like Bellevue? I was very surprised. So I'm glad to be here, and again, to participate in this discussion. Thank you.
Thank you, Jean Calvin. And yes. Well, and so many great reflections there. I think you just gave a great story in life to that idea of reciprocity, right? And what these types of investments and really focusing on relationships can have both for the child and for the parent. I love the idea of a playground full of books and thinking about how we can kind of continue to socialize that. We're going to move next then to Aditi. So Aditi, maybe spend some time just talking a little about Medicaid. I'm sure there's lots of folks in the audience that are aware of the Medicaid program, but also then thinking about, how CMS is thinking about early relational health and ways that it can really incentivize, that magic that Jean Calvin just talked about. How can it really incentivize to make sure that's happening and supported in all our communities?
Thank you for that. To the first part of the question, maybe I'll do a little bit of a, I've been there, I love that sound. A little bit of a Medicaid 101, and I realize that for some folks in the room, a 301 would be more appropriate, but I'll just, I'll share. So Medicaid is a state and federal partnership. The federal government sets the guardrails, the states do the operationalizing. States are able to draw down federal match, so a state spends on average 30 cents that gets matched by 70 cents on the dollar by the federal government to run a comprehensive Medicaid program. The genesis of the Medicaid program was to be medical assistance, and this is in statute, medical assistance for low-income people. So it started out as a program that was geared almost entirely to low-income mothers, children, and again, statutory language, not my choice, the aged, blind, and disabled. Over time, particularly with the passage of the Affordable Care Act, the eligibility for Medicaid in most states, except for non-expansion states, a whole nother discussion, in many states across this country, but for 10 of them or so, now includes individuals up to a certain level of the federal poverty level, usually 138%, but states have discretion as to what income level to cover, in particular, quote unquote, childless adults. But anyway, all that to say, Medicaid is the backbone of the healthcare social safety net in this country. It's maybe the most important thing to know. And you heard me say earlier that it is the predominant insurer for children in this country, particularly children who are low income. CHIP, the Children's Health Insurance Program, is a slightly, generally speaking in most states, is a slightly higher income band than Medicaid. So it's children who would qualify for Medicaid, but for their family makes a little bit too much money. And so those children are offered health insurance through CHIP. How does Medicaid work? Like, how do you identify a service and then figure out how do I get it paid for? Because that's the question I get asked, I'd say 80% of the time. So by law, Medicaid is divided into, and these are statutory categories in law, mandatory benefit categories and optional benefit categories. A mandatory benefit category means all 56 Medicaid programs across all 50 states plus DC and the territories has to cover this program. This is things like inpatient services, things like preventive health services. Every Medicaid program in the United States covers those mandatory benefit categories. Then there are optional benefit categories. And as the name implies, it is at the state's option to provide that set of service. So whenever folks reach out about a new device or a new service, and let's use Reach Out and Read as an example, seems topical, where might that fit, right? How does that as a service become billable and therefore sustainable in terms of healthcare reimbursement? So step one is to think about, well, what benefit category might this fall into? One could make an argument that it would fit into a preventive service. One could make an argument that it might fit into an outpatient clinical service, but it has to fit into a benefit category. The second is then, and maybe I should back up a second and say, you've seen one state Medicaid program, you've seen one state Medicaid program. And so even though it is federally regulated and our agency, CMS, sets the guardrails and says, you can do this, but not this, or here's some guidance around coverage of non-emergency medical transportation, or here's some guidance for coverage around preventive health services. You see 56 different versions of how those services get implemented, who can enroll as a provider in the program, how those services get paid for, et cetera. And so I'm conscious of time because I want to make sure others on the panel get to speak, but all of that to say, when you think about these interventions, they have to fit into a benefit category, and then that benefit category has to map to what that particular state that you are operating in will cover based on who is enrolled to provide services in the Medicaid program. So I wish it weren't so complex, but that's the reductive, oversimplified version. It is in fact far more nuanced than that. Now, just maybe 30 seconds on the second part of the question of how does CMS think about early relational health? And you heard me say this earlier, we really do understand the idea of whole person health, that children, adults, everybody across the age span exists in a context that is not just their physical body, right? So I think increasingly, not just at CMS, I think across the entire policy landscape in general, an increasing focus on the importance of mental health, substance use disorder services, family caregivers, and I could cite for you a number of different policy examples of that, but really understanding that it is not just an accessory anymore, right? It's not just, oh, we'll pay for vaccines and we'll pay for well child visits, but that in fact these types of services are core to creating an environment where children can thrive, which is really ultimately at the heart of what Medicaid is for, right? Is that this is medical assistance to make sure that the most vulnerable among us can thrive and live their best lives too.
Thank you. And, with that frame, right, what CMS does, health systems are really responsive to, right? And so Pahoua, thinking about what HealthPartners has done to really center early relational health, not only in the practices so that patients and their family members have experiences like Jean Calvin described, but has really been a leader, I think, in bringing others in the community, other health systems, programs like Reach Out and Read, other community-based organizations that are working directly with parents and young children to a table to kind of think about how they can use and amplify the message of early relational health. And so maybe speak a little bit to both that, how HealthPartners has kind of landed in the place it does and some of the lessons they've learned.
Sure. So as I mentioned earlier, I don't have a background in healthcare, but I work for healthcare now. What I will say is I have long been in the work of community capacity building and collective action work. And so one of the reasons why I said yes 2 years ago to work for HealthPartners is that they are the largest consumer-governed nonprofit health system. So there's a plan side of our business, and then there's the care provider system part of the business. And I said yes to HealthPartners because even before I was aware of the mechanics of our healthcare operation, I knew about their community-based work already. So several jobs ago, I worked for public television. We partnered with HealthPartners on a Make It Okay mental health stigma program that's still going on today. The program that I'm going to talk about in a second is called Little Moments Count. And it actually uses a lot of language from Dr. Lee's talk earlier about just these little things that we can do or encourage parents to do or remind them to do that really help a child's brain develop in those really important first 1,000 days. But before I go on to talk about Little Moments Count, I want to just frame that HealthPartners has 8 hospitals. We have 3 in western Wisconsin. We have 2 in our metro and 1 right on the border of Minnesota and Wisconsin, and then 2 in rural Minnesota. And I mentioned the location because it's important because Minnesota and Wisconsin, we have a great relationship with Reach Out and Read. So I know Chris was here earlier. I want to thank Chris and give a shout out to her because she's been at the table with HealthPartners and our other community-based organizations from the beginning of Little Moments Count, which started in 2016. And the idea was we had all of these really great nonprofits serving community members, caregivers, parents, children already. But what we were missing was a steady drumbeat of the science behind the little things that we can do. And so this came together around 2016, 2017, and it's still around today. We have Lots of resources online. In a moment, I'm going to make you take out your phone and text something so that you can get connected to some parent-powered texts that our parents who sign up for it get. So it might be 2 p.m, you'll get a text that says, hey, this might be a good time to do some tummy time with your child, depending on how you enter the data of the age of the children in your family. But Little Moments Count is it's mainly focused on 5 serve and return activities. So singing, talking, playing, reading. I always miss one. Storytelling, which is important, especially from the community I come from. I'm a Hmong person, and we have an oral tradition. So reading wasn't something I grew up with, but storytelling was a big piece of what took place in my household with my grandparents and small children. And so it's around these 5 activities that really, I think, complement the Reach Out and Read programs. And so one of the things that I get to do now as a staff member, along with the team that I have, is this program, and I would love to talk to anybody who would like to replicate this where you are. This program only works if there's an anchor institution like a HealthPartners. So we co-create this program with our partners, but by design and on purpose, it is not branded HealthPartners. It is branded Little Moments Count so that it can be owned by all of our partners. We have 85 partners right now, ranging from cities, counties, community-based organizations, other health systems, so that we're doing this work collectively and together so that when a child leaves any of our hospitals, and we give parents so much when they leave the hospital after a birth, one of the sets of things that they get is all the Little Moments Count information, and we also at that time see if they will sign up for the text. Okay, so I'm out of time, but take out your phone, and I'm just going to do this one last thing. Okay, you're going to text to the number 70138. You're going to text the initials LMC, Little Moments Count. You're not going to type up Little Moments Count, though. It's just LMC.
70138.
70138. I tried this morning. It worked for me.
I have a 7-year-old, and I've been getting texts for 7 years. So it works.
So you put in the age. Great. You put in the age of your child. Don't put your age because you're not going to get anything because it's going to push out information based on the child's age. So I did it and I made up a date. Now I'm going to continue getting texts. So these are just some of the ways, Nate, that we're helping support community be reminded of the things they can do because there's a big expectation gap. In our community, we know that 91% of parents believe still, even with all the data that we're pushing out, that you don't need to talk to your child before the age of 3 months. And we know that is going to be problematic in terms of brain development.
All right. Thank you so much, Pahoua. Yes, and I'll just say, if you do sign up, you'll get a text on Monday, Wednesday, and Friday. And it'll be like a little bit of a broad idea on Monday about what you can do, a little maybe tip on Wednesday on how to do that. So, you're working on gross motor functions. And then on Wednesday, it's, maybe you could help them. They could help you with the laundry. Give them your socks and see if you can throw it in to the laundry basket. And then Friday's like, make a game of it. Who can get the most socks into the laundry basket? So, it gets really tries to help meet folks where they're at with those kind of developmental tools. So thank you so much. I want to thank the panel for our kind of initial introduction to where everyone's coming from, the perspectives we hope to share. I'll hand it over to Nikki to kind of talk about the next steps, and we'll go from there.